Welcome back to our channel. Today we're tackling a crucial health topic that everyone needs to understand. Stroke. It's a leading cause of disability and death worldwide. But don't be alarmed. With the right knowledge, we can effectively prevent and treat it. So what exactly is a stroke? It happens when the blood supply to a part of your brain is suddenly cut off. There are two main types. The first is an ischemic stroke, which makes up about 85% of cases. This is when a blood clot blocks a blood vessel in the brain. The second type is a hemorrhagic stroke, which occurs when a blood vessel in the brain bursts, causing blood to leak into and damage the surrounding brain tissue. Now let's talk about the causes of this dangerous condition. The number one culprit is high blood pressure. Over time, high blood pressure damages the walls of your blood vessels, making them more likely to form clots or rupture. Next up is diabetes. High blood sugar levels can also damage blood vessels throughout the body, including those in the brain. Another major risk factor is high cholesterol, which leads to plaque buildup that narrows your arteries. Certain heart conditions, like atrial fibrillation, can also create blood clots that travel to the brain. And we can't forget about unhealthy lifestyle habits. Smoking, excessive alcohol consumption, a lack of exercise, and being overweight significantly increase your risk of having a stroke. Recognizing the signs of a stroke is critical because time is brain. A simple way to remember the signs is the acronym F. A-S-T. F is for face. Ask the person to smile. Does one side of their face droop? A is for arms. Ask them to raise both arms. Does one arm drift downward? S is for speech. Ask them to repeat a simple phrase. Is their speech slurred or strange? And finally, T is for time. If you see any of these signs, it's time to call emergency services immediately. Every minute that goes by, millions of brain cells are lost, so getting the person to a hospital as quickly as possible is absolutely vital. When it comes to treatment, the approach depends on the type of stroke. For an ischemic stroke, if the patient gets to the hospital within the golden window, usually less than 4.5 hours from when symptoms began, doctors can use a special medication to dissolve the blood clot. In some situations, they might perform a procedure to physically remove the clot. For a hemorrhagic stroke, treatment focuses on controlling the bleeding, reducing pressure on the brain, and sometimes requires surgery. After the initial emergency is over, rehabilitation becomes the priority. This includes physical, occupational, and speech therapy to help patients recover as much function as possible. But the best way to handle a stroke is to prevent it from ever happening. Start building a healthy lifestyle today. Eat a balanced diet full of fruits, vegetables, and whole grains, while limiting salt, sugar, and saturated fats. Aim for at least 30 minutes of exercise most days of the week. Maintain a healthy weight, quit smoking, and limit alcohol. And just as importantly, get regular health checkups. Monitoring your blood pressure, blood sugar, and cholesterol levels allows you to catch and manage risk factors early on. We hope this information has helped you better understand strokes. Remember, your health is your most valuable asset. Arming yourself with knowledge and taking proactive steps to prevent disease is the best way to protect yourself and the people you love. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, share it with your friends, and subscribe to our channel for more useful health tips. Stay safe and we'll see you in the next video.